What distinguishes the RNS system is the mass of clinical data.
The post-approval study was a really nice, large study that was done with the FDA, looking at the data, designing the trial, and it gives us a lot more certainty about how effective this therapy is.
The more data you have, the better and more reliable your results will be.
The results are very strong. It works quickly.
I think the 6-month 62% median seizure frequency reduction is great. From this data, even at 6 months, patients have a third the amount of seizures that they were having before surgery, so I think that will be really exciting for patients.
So an 82% reduction at 3 years is really significant for the patient.
The RNS system compared to VNS or DBS at 3 years offered basically twice the reduction in seizures. So the RNS post-approval study showed an 82% seizure reduction at 3 years, whereas comparable trials in DBS or VNS offered only about 40% median seizure reduction.
Also, 42% of patients had gone at least 6 months without a seizure over this period of 3 years.
With a large study like the one we have now, we have good reason to suspect that a large number of patients, up to 1 in 4, might have about a year of seizure freedom, or even 40% have 6 months of seizure freedom, which again is a really significant improvement and something that it might be beneficial to a lot of the patients we treat.
I think there's many of our patients who have been really successful with the RNS device and have had prolonged periods of seizure freedom, and that's really been life-changing for them.
One of our goals as either neurologists or neurosurgeons is to reduce the number of seizures our patients have. When they're having uncontrolled seizures, that increases their risk of sudden unexpected death and epilepsy.
SUDEP is definitely a dark cloud, probably in the back of the mind of every epilepsy patient, and especially their families and loved ones. Even more so for our drug-resistant epilepsy patients, where the risk of SUDEP is so much higher. I think having an intervention like the RNS that can reduce their risk of SUDEP by 3-fold would give them so much more peace of mind.
This therapy has to be considered.
With tools like RNS now, there's almost no one who's not a surgical candidate.
We have a responsibility to try to reduce the seizure burden for every patient we meet with epilepsy. Complacency is the enemy.